Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. And in this edition, we're going to talk about something somewhat sensitive. It's dealing with race relations. And as you can see from the title, it is, actually I don't know what I'm going to name this yet, but something along the lines of um, nursing while black or something along those lines, type of thing. And so basically the for story is this. My daughter come to me saying, is it difficult to be a nurse and be black, or be a woman and be a nurse and be black? Does gender and race play a part in your job, or do you have any issues with that? And so she really had me thinking, and I really want to talk about this subject, but it is such a touchy subject that I was like, I'm not sure. But you know what? If my daughter wants to know something, she needs to know how the world really works. And so therefore, if my daughter who's 20 needs to know how it works, so do my new nurses out here, new nurses or future nurses or whatever you happen to be, need to know how the world works for us and against us. So if you want to see or hear my story, stay tuned. Hey YouTube, and so I just wanted to come talk to you about a touchy subject that my daughter had brought up to me regarding race relations in nursing, and she wanted to know if I experienced any of these situations before. So I thought that this would be a great time to kind of talk about some of the things that I have undergone as a African American nurse, and so that you can kind of have a better insight about what you can expect. I wouldn't say expect, because it depends on where you live and how the culture is there. But I'm in the South, just so you know. And not that racism is not, overt everywhere, because it is. But definitely in the South, it has some roots. So I'm going to leave it at that. So anyway, I'm going to just basically have, give you some insight. And I know this is kind of a tough subject. So I have no notes. I have nothing. I'm just kind of going on top of my head and just kind of venting or let you know what my experiences are in nursing specifically, and what I've kind of endured over the past almost 15 years now as a registered nurse, and give you some examples of how I've been made to feel that definitely my race has an impact on whether I achieve what I set out to achieve. So this will kind of offend some people, I'm quite sure, and I'm okay with that, because I've been offended all my, I won't say all my life, because I hadn't experienced it all my life, but at least all my nursing career. So this is not to, this is not to say, well, everybody's a racist. Everybody's not, okay? And that's not what this is about. This is strictly about my experiences as an African American nurse in nursing. We know what racism is like outside of nursing. We could all tell stories about that. But I wanted to share with you some of my experiences specifically in nursing that I've endured from my own people as well as my counterparts. So let's go ahead and get started. It's kind of like a story time, so I'm gonna give you some scenarios that I've been in so you can have an understanding of what I'm talking about. So many of you know, if not, if this is your first time watching my videos, I'm welcoming you. Thank you for coming by. This is a tough topic, so you're gonna get the raw and uncut version of this topic, but it is what it is. Thank you so much for joining us. If you're old, you know how I am. I'm gonna say exactly how I feel. I don't really dance around things. I'm straight to the point. But I do want, to have this dialogue in a professional manner. So I'm not here to bash anyone, but I just want to tell you what I've been through. So let's jump right in with my first story or scenario, if you will. So give you some backstory. I am a registered nurse, been a nurse for almost 15 years. OB is my specialty. I have 3 degrees. I'm working on the 4th one. I'm working on my doctoral degree at the moment. And basically, hold on, let me get adjusted here. Okay. A little bit more so you can see me better. All right. So I'm getting adjusted here. But anyway, I have been a registered nurse for almost 15 years. And so I have some stories. I have 15 years worth of experience in terms of dealing with the public and dealing with um, nursing issues or concerns being a minority nurse. So with that being said, my first story is this. I have been, when you think you are getting a job into nursing, you're thinking that it's an accepting profession. For the most part, it is. But they accept you based on certain grounds, mind you. So I'm here to tell you or share with you, especially to my African American nurses or nursing students, the ones who are already nurses, who've been nurses as long as I have been or longer, they already know this. You just listen, okay? You just listen and share your story in the comment. But the rest of you, whether you may be any other race or whatever, let me share with you my experiences so you can understand kind of what we as minorities go through. At least that's my experience as a minority go through. And if you happen to be a nursing student, and I'm not trying to scare you from nursing, come on, because we need you. We need people who look like you and but I want you to be mindful about what you can prepare yourself for when it comes to nursing and how the world is. And if you haven't experienced the regular world of racism, then guess what? You're going to have your other kind of world here. And to me, to be honest with you, for the most part, it's covert racism, not overt. Overt basically means it's in your face. It is in your face. I can't stand you, you know, whatever they want to call you. Covert racism is when they do things kind of underhandedly or slide behind your back. But then when it all comes together, you realize it was about that situation. So I'm going to give you examples of some covert racism that I have dealt with. And as just so you have back knowledge, Tennessee is an at-will state. I live in the state of Tennessee. It's an at-will state, meaning that they can fire you for no regard. So they don't have to have a reason to fire you at all. They don't like how you look today. We don't really need you. Guess what? Here's your pink slip, okay? So I'm saying that disclaimer so that you know that if they wanted to get rid of me, nurses come a dime a dozen. They graduate in every, 6 months or so. So it's not like you can't find somebody to replace me, first and foremost. So if I'm not doing my job, not doing it well, you would have already let me go because Tennessee's that kind of state anyway. So the stories I'm about to tell you, keep that in mind when it comes to my work situations that I'm talking about, because I could have been let go a long time ago. Okay. So this is the first situation right here. We're going to start with nursing students. So how is it being a Black nursing instructor? Okay. How are you received? How well am I received by students? Now, keep in mind that nursing is a female dominated profession, and our counterparts, our Caucasian counterparts, actually are a majority of the nurses, if you look at it from that perspective. Minority wise, collectively, minorities kind of represent about a good, I want to say 18 to 20% of the nursing profession, minorities collectively. Now, African-American nurses only represent closer to 10% of the U.S. population of nurses, all nurses, not just registered nurses, but just nurses, okay? So that's including your LPNs, your RNs, your 2-year RNs, 4-year RNs, your NPs, your doctoral, all the levels up for nurses, not CNAs, nurses, that encompasses all of that. So we don't represent that much anyway. So obviously the people who are coming into nursing happens to be of the other persuasion, okay? I don't have an issue with that. None whatsoever. But this is the thing here. So when I come up into nursing, or I come into when they see me as their instructor, they're looking at me like I'm closer to their age. And I may have a young face, and I'm grateful for that. But it does have its drawbacks, because then they think they can kind of talk to you any kind of way, and as if I'm a peer. And I have to go ahead and set that straight, quick. That no, I'm old enough to be your mother in most of these situations. I do have a 20-year-old, so I'm old enough to be a lot of these students' mothers. Not all of them, but a lot of them, they're mothers. And so I won't be talked to any kind of way. And so we have students calling me by my first name. I would have never did that when I was in nursing school. I don't care if you was 2 years younger than me. I would have never called you by your first name in nursing school. Part of that is generational. I will say that. Part of that is not due to per se race, but a lot of that is generational. That's just kind of how the generation has kind of turned and things like that. But some of that has a lot to do with just kind of where we are, that they think they can call you by your first name when they're calling everybody else Mrs. and Mr. such and such. So I have to go ahead and set that straight, from the beginning. So we have students who, like I said, who are not receptive. They're not receptive at all that they can have a Black instructor and that she can be well educated, but yet well educated at that. and that she may actually know what she's talking about, because all their other instructors kind of know what they're talking about as well. But I surely can't be, just as intelligent or educated as my peers, my personal peers are. That's how they make you feel. And so then what the students tend to do is they'll go back and try to tell my superiors, oh, well, she made us do a head to toe assessment by ourselves. I'm like, you're a senior student who's about to graduate next month. You can't do an assessment by yourself? So what have you been doing for the past 2 years in school? You should be able to do an assessment by yourself. You mean you can't go and knock on the door and do a set of vital signs by yourself? So now I'm considered the hard one because of the fact that I have them go do X, Y, and Z by themselves when they've done it before, should have done it before, because they're seniors. They're going to graduate in a month. No, 2 months. This is March. They'll graduate in May. 2 months. No, sis, you go do that by yourself. You need to learn how to be independent, autonomous. They don't understand what that concept is like, but yet they think they're going to get in the real world when they throw them out there. So that's one scenario. I had another scenario at another school with a Caucasian male student who was just like, the only thing I was telling him was he was doing a simulation and he had said, I'm going to give this patient, I want to say 25 milligrams of morphine. We were doing a simulation on hemorrhage, on postpartum hemorrhage. And he's going to give so much morphine to this patient. And so then as a result of that situation, the blood pressure was already 70/40 in simulation, mind you. And I'm like, no, you can't give 25 milligrams of morphine for somebody's blood pressure 70/40. You're going to kill them. And that's pretty much how I said it. And I was trying to explain to him why we wasn't going to give that much. And don't you know, he went back and reported that he is intimidated by a strong black woman. That had nothing to do with the scenario. That had nothing to do with it. My tone is exactly how it is now. I was being educational. I was like, no, you can't do that because you could kill the person. And he had never been told that before. So who's teaching them when I'm not around? Who's teaching them to critically think? And so I really push critical thinking. I push being a strong nurse. I don't care what you look like. I want you to be a strong nurse, because at the end of the day, you're going to take care of my family. At the end of the day, you're going to take care of somebody else's family. You're going to take care of somebody's child, somebody's mother, father, sister, brother, whoever. You're going to take care of someone. And I want you to come out, when you leave from me, you will come out knowing something. You will come out being ready to be a nurse versus people just passing you through because they can pass you through. That's not what I'm about. I'm like, if you want to be a nurse, I'm going to teach you. And that's exactly how I teach everyone. If you want to be a nurse, now mind you, that's going to be hard because they didn't hand me no degree. I didn't walk up into line and say, I want a degree in nursing. Could y'all give me that? No, I had to go work for that degree and work for everyone that I had before and after that, and working for the one I'm getting now. So no one hands degrees out. And when it comes to nursing, I want you to be serious about, what you're doing as a nurse. And so therefore, I'm really pushing that critical thinking aspect that students are lacking in today's nursing world. So he went and reported that, she's a strong black woman. I don't do well with that. And luckily that school backed me up, and it's like, okay, well, it doesn't make a difference who's teaching you. You need to learn the material. If you didn't have an issue with the content, don't have an issue with what she looked like, if that makes sense. And that's kind of how that happened. And, as a result, the relationship after that with that student was fine. But again, it had everything to do with my color. But when my counterpart, who's sitting beside me, said the exact same thing to him, oh, okay, that's cool. Okay, I understand what you're talking about. But when it came from me first, we had a problem. That's kind of what I'm talking about. Example number 2. It's very hard to be a registered nurse with plenty of experience like I already have. And, you've been working at the same job for 13 years. And it's probably been about 5 or 6 years now. I'm not sure how long it's been. But when a position comes open for you could potentially advance into, no one actually considered me for the position. Was I qualified? I was overqualified. You had to have your master's degree. You had to have some experience in teaching and all that other stuff. I already had all those things. However, they brought someone in who was underqualified and said, Marita, can you teach her what you know? So basically, I'm teaching somebody to be over me. That's how it's working, or that's how it works. But you know, it's okay because I'm about to get my doctoral degree, and after that, it's not gonna make a difference anyway. But I'm saying that's kind of how it works in nursing sometimes, where they'll have you, the minority nurse. They don't ask you if you can change, if you interested in this next position. They will have somebody come in from the outside and have them come in, know nothing near what you know, and have you train them to be your superior. That's how it works. At least right around here. I'm not saying that works everywhere. That's how it is around here. Also, I have a friend who she has a position. They was actually hiring for someone to go into the management position in her at her place of employment, and she's a nurse as well. And they interviewed her, and they interviewed a few other people, all minorities, mind you. She doesn't have a master's degree, but all the rest of them did have a master's degree. Don't you know they hired someone who was associates prepared for that position, who happened to be white? And nothing against white people at all. I don't have nothing against them, really. But this is the thing. That proves my next point. So, in order for us to get a job in management, we got to have the master's degree and beyond, and certifications and everything else. They only have to have the associate's degree and know somebody. That's it. That's my experiences here where I live at. So we have to have more education to do the same jobs as somebody else who has less education. We have to work twice as hard. That's what that means when people say you have to work twice as hard. Twice as hard to have that education just to have the same degree that somebody comes in with an associate's degree to do the exact same job. Now, I will say this. If the associate's degree person is better qualified because they have experience and this master's prepared person has none, okay, I'm not mad at that. But when you have a master's prepared person who meets all the criteria, passed all the tests, and they're already within the facility, then you go outside the facility and bring somebody else in? Why are we doing that? That's a problem. But that's kind of what I'm saying. That's why I say that that's the truth behind nursing. Here's scenario number 3. So then I have a situation where I am in the hospital setting, and I have a patient who happens to be African American, and her mother is, of course, African. Well, not of course, but her mother's also African American, and she's also a nurse. I don't know if she's retired or not, but she was a nurse. And so the people I'm dealing with are black, okay? And the mama's black. And so I'm in the room, the baby's in the room, the nursery nurse, so the baby's nurse is in the room. So me, the nursery nurse, the mom, the grandmother, and the baby are in the room. I'm asking the mother, would she like to get her Tdap vaccine? And so she's like, I'll think about it or whatever. And so her mother says, well, what are the side effects? And so I just basically tell her that, there are no really major side effects to the Tdap vaccine other than the site, soreness from the site, and then your arm will be kind of sore later on. But typically there's no other major side effects. But we will be watching for that if, something were to occur. So don't you know, the grandmother, turns to the white nurse and says, so just to make sure she's correct, talking about me, what are the side effects of the Tdap vaccine? So then the white nurse looked perplexed. She was like, well, she just told you, And so I already knew what that was about. So we even get it from our own people. We getting it from our own people where, okay, you got to check me. Now, first of all, you're a registered nurse. Why come you don't know what the side effects of the vaccine is, whatever. That's kind of my point. So we have people within our own race who kind of tear us down. So we have to be mindful that not only are they coming from us, but sometimes we come from ourselves. And so the nurse at the end of that, she said, what's the same thing she said? So after we walked out the room, the nurse said, well, what was that about? I said, you'll never understand. You'll never understand what that was about. That's kind of my point. I know what the side effects of these medications are. I know how to do my job, and I do my job pretty efficiently. Now, with all that being said, if I didn't do my job, like when I was saying earlier, if I didn't do my job well, this state will let you go. If you don't do your job, patients complain about you on you all the time. Doctors are complaining about you. You gone. They don't play that here. So if I was doing such a bad job at my job, why am I still here if I'm doing okay? I'm not saying I excel at everything, but if I'm doing okay, I'm doing my job. Why am I still here? Those are kind of my points. So I just want you, those are just a few examples of how being Black woman in nursing is very, very difficult, because you have to work harder and harder and harder and know more and read more books and get more degrees and get more certifications just to be at the same level as your peers who ain't got to know nothing. That's the truth. That's the raw truth. And when, not to kind of piggyback off that, I know you all are familiar with that college situation where people, some of the celebrities have bought, their children into these institutions and whatnot, these Ivy League institutions. And that's kind of my point. Because that means somebody, if they were bought into those positions, they paid for those positions to get those spots. That means somebody who worked their tail off could not get in because somebody else just went and did what they had to do and bought their children their way in. How is that fair? I guarantee you that's been going on for so long. That ain't nothing new. It's just not coming out. It's just not coming out. How do you think this works in the rest of the world? So that's how it works in the collegiate academia side. That works the same way in the workforce. It works the exact same way in the workforce. You don't know how many jobs that I've seen people get jobs because of who they knew, not necessarily because of what they know. Myself included. Myself included. So this is not a race thing. This is a who you know thing. Because there have been jobs I have that I never even applied for. People just call me and say, hey, we need an instructor over here. Can you come do this, that, and the other? And I'm like, what's the pay? And if we get that situated, I'm like, oh, okay, I'll be over there. I haven't had at least 1, 2, 3, 4 jobs that has been offered to me or that I actually did work because of the fact that, it was who I knew or who knew me. That's why networking is very important, y'all. So make sure y'all network. Because I never applied for these jobs at all. I never seen HR. I don't even know where HR is in that facility. But yet getting a check for doing this job. They needed somebody. I knew how to do the job, and here I am. So there are some things they're definitely more not really race, but it's more so about who you know. So that's why it's good to network. But I digress. That's not what this is about. This is about the fact that I have had to work so hard to get to where I am, that when, even with me in my doctoral journey, 15 months left. Oh, no. What's today? Today is what is today? The 16th of March. So I graduate in 14 months. Again, not to digress, but I graduate in 14 months. May 16th of 2020 is when I graduate from my doctoral program. Anyway, that's not what this is about. It kind of is about that. Do you know how many people giving me the side eye? My people included with the other people about I'm going on to my doctoral journey. Why is it that y'all think the best thing that Black women, Black nurses could be is an LPN or a 2-year RN? Why do y'all think that? Why do people think that's the best we could be? See, that kind of goes back into that slave mentality that some of us still have about the fact that, okay, well, you know what? They let us in. So the best I'm going to be is a LPN. I'm going to be an LPN. I done made it. No, sis, if that's what you want to do, that's fine. Not knocking any of that. Do you? But why is it that you feel like, okay, you have to stop at the 2-year RN or whatever it happens to be? Go as far as you want to go. If you want to stop there, stop there. If you want to keep going, you keep going. But I'm sick and tired of that. Do you know how disheartening it is when I walk into any facility, either it be nursing home, hospital, or hotel or anything like that, and I happen to see all the Black people doing housekeeping, and they not using it as a stepping stone, not knocking housekeeping, because you got to do what you got to do. I'm not mad at that. But why are all we down there? And so even for me, myself, people say, oh, okay, are you a nurse? And I'm like, yeah, I'm a nurse. Oh, okay, so are you a LPN? I'm like, no, I'm not. I'm a registered nurse. Oh, okay. So when I tell people I'm going back to school, guess what they think I'm going back to school for? My BSN. No, I already have that. Thank you. I'm going back for my doctoral degree. For what? They don't even know what that is. They don't even know what that is. They don't even know that you can have a doctoral degree in nursing. And in case y'all didn't know, you can have a terminal degree or a doctoral degree in nursing. And that's what I'm about to get in 14 months. They think the best we could be is wherever they want us to be. And I'm trying to take those rose-colored glasses off of your eyes and clear that lens so you can see things for what they really are. Some people are trying to hold you back. Some people will smile in your face. Meantime, they're stabbing you in your back. I tell people any day, I'd rather deal with somebody who is directly and tell me they hate me because I know how you feel than the one who stands beside you, who even helps you. They will help you. Just to go back and run and tell what you done told and then be your boss after that. I done seen it. too many times. I haven't experienced it that per se where someone's did that to me, but I definitely have seen it too many times with different friends where there'll be ideas that they've come up with to help change things for the better for the unit or for the hospital, whatever it happens to be. And then next thing you know, that person who's supposed to be they main one who's supposed to be right by their side helping them, guess what happened? They done went and took the idea that they come up with, and now they don't went over there and now they their boss. Or now they the CNO. And they done left you on the floor. And you got the master's degree or you got the advanced degree, excuse me, or you're pursuing the advanced degree, and they got a bachelor's degree. And they the CNO. You know, do you know how many, I just talked to, a matter of fact, I just talked to a nurse in January who had told me when they saw her application and her degrees that they invited her for an interview. Then as soon as she get in there for the interview and they see her, because she looked like me, they didn't have a position available all of a sudden. They didn't have a position available. Because see, they didn't want someone who looked like her overseeing that whole department. She was furious. Furious. She said, well, I still see the actual position on the website. So how, you know, how there's not a position for that? Because it's, as of this morning, it was still posted. And so if you actually had, and so that's when they went, oh, we're interviewing all candidates, but you know, we have already made a decision. If you already made a decision, why are you interviewing me? Is what she said. That's kind of my point. That's how they do. So that's the reason why I say you have to be educated. I'm speaking to my nursing, my new nurses, my nursing students, my CNAs, even nurses. If you are, again, experienced, you have at least, you know, you have more experience than I do. I have only 15 years. If you're more experienced than I do, please share some of your stories, because people have to know this is what happens in nursing. I'm not afraid. I'm going to have me a job regardless, because nursing is so vast that, you know, we can go get us a job. And I have not said nothing. I haven't called any names or anything like that. I'm not saying anything offensive. Well, actually, it may be offensive to some, but it only is offensive to them if it fits them. So, you know, if it fits you, then they said a hit dog will holler. So I guess you're going to have to holler. That's how I see about it, how I feel about it. So that's the truth. You know, my daughter really brought up this topic about how is it really harder for me to do the things I want to do? Do I have a harder time with, you know, relations with people in terms of people relations or whatever? People think because you're a black woman, it means you either, you know, you don't know anything, you're ignorant, somebody gave you the job. Ain't nobody gave me nothing. I applied for the job and I got it. No one gave me my nursing degree. I worked hard and I got it. You know, and I just feel like sometimes we don't have to work, we have to work kind of twice as hard to be at the same level, is all that I'm saying. So hopefully this video has been insightful. I don't apologize if it offended someone. I don't. Because like I said, I've been offended my entire nursing career. My entire nursing career I've been offended. From patient relations situations who people have lied on me and said this, that, and the other, or even from situations where what the situation was. Oh, I had a my very first job. I was a nurse graduate. And it was this hospital that I always wanted to work at. And I did my intern there, actually. My preceptorship, I did it there as well. And it ended up that, you know, I did my intern and my preceptor, and so they had a big old sign or banner that said, you know, we're hiring new grads or whatever. So I go to the nurse manager because I'm like, okay, I've been doing my intern here. I love it. I know what I want to do. And I said, I said, I would like to get a job here when I finish with my schooling, which is like in a couple of months or whatever. She said, oh, we're not hiring new graduates this year. Mind you, there's a big old banner behind her that says hiring new grads. And you're not hiring any new grads, and like it wasn't time for it to be up, because school wasn't gonna be up for the 2 months type of thing. So I was like, oh, okay. That was very hurtful, because that was kind of my first whiff of it, but that's hindsight because I didn't see it back then. So I went and got a job at another hospital that was hiring new graduates, and actually did. And guess who happened to be my patient? This is how karma works. So she decided to have a surgery, not at her hospital, but at another hospital, sister hospital. I guess because she didn't want to deal with her coworker, you know, her people underneath her. So she decided to come there. And lo and behold, I was in training and she was my patient. And so she was like, don't I know you from somewhere? I was like, oh, yeah. You know, you over from this other hospital where you said they wouldn't hire new grads. And that was so unprofessional. I admit that. Don't do that. I did. But I was furious because look how karma works. So here I am, the person that she, you know, didn't want to have her at her job, at the place that she said, the other, you know, I ended up being her nurse after that. I was in my orientation, so I was another nurse who was with me, but I was at a point in my orientation where I could go do my thing, do my own thing, and she was just kind of followed behind me. So she was just like, oh. And so when she realized, when she came out of the anesthesia, really woke up, she realized who she was talking to. She changed her attitude so quick. She never thought she'd ever see me again. And I was the nurse that she, you know, didn't want, because guess what I look like, you know? And my color ain't changed since then. I ain't got no lighter. You know, I'm the same person I was 15 years ago, with more education and more experience, obviously, but still. So she said, you know, oh, okay, well, how have things been? I'm like, oh, things are great. I'm learning a lot. You know, I said, it's good to see you. And I left it at that because, again, there was really nothing else to talk about. And I provided her excellent care like I would anybody else. And she treated me great after that, like as she should. And then that was that. But again, I have experienced, you know, forms of racism or either overt or covert racism my entire nursing career, where, you know, people would intentionally do things to kind of make you feel like you don't know anything and treat you as such. So anyway, this venting session has been long enough. So if you happen to have stories of your own, please comment them below. I would love to hear about other stories, not because we want to celebrate these things, but we want to make sure that people understand that they're not alone. And as these new nurses are beginning to come out in the next few months, that they understand what they're going to get into, and for them to take those rose-colored glasses off and basically see it for what it is. So you're going to have a double whammy if you happen to be a new grad and African-American, male or female, in that situation. Because as a new grad, you already have people don't want to preceptor you. They're like, oh, here we go, the new nurse thing. They don't want to teach the new grad. So you're going to have that and the fact that you're black against you to begin with. So you're going to have, it's a hard pill to swallow, but I definitely want you to understand you will get through this. You'll be just fine eventually. And you will go on to achieve whatever you wanted to achieve in life. And don't let anybody hold you back. And if you want a certain job that you wanted and someone has, you know, you had to teach somebody how to do the job above you, go get the experience that you need, move on, and then you go get the job you're supposed to have. So don't settle for that either. I'm not settling for that. I'm just going to stay where I am right now. So I finish school, and after that, you never know what I'm going to be into. So I want this video to enlighten and to inspire, not for you to act like this or for you to, you know, be discouraged, but for you to understand this is how it is, especially if you live in the South, like I do. But I'm sure it happens all over the world. I'm sure it does. So anyway, if you like this video or videos like this, story times, thumbs this video up. If you could please hit that notification bell so you'll know the next time that I upload a video. Subscribe if you haven't already. And until the next time, you all take care. I will see you in the next video. Bye-bye.